There it is, at the very top. Get my cover to meeting controls. Okay, so welcome back. Ethics, boundaries, laws, and regulations. These are 30 questions, and please stop me at any point if you have any questions or if anything is unclear. Right, otherwise I'm going to try to get through these in a timely fashion so that we can spend a little bit more time on things like kinesiology, A and P. Right, what does the word abuse mean? A professional relationship in which a more experienced practitioner shares information, skills, and insights with a less experienced practitioner to provide encouragement and support. The improper use, handling, or treatment, often to unfairly or improperly gain benefit. To withdraw support, especially in spite of duty, allegiance, or responsibility, or an obligation or willingness to accept responsibility or to account for one's actions and consequences. Definition of the word support. The improper use, handling, or treatment, often to unfairly or improperly gain benefit. A code of conduct that provides guidelines to those who post content on the internet, either as part of a business or as a private individual, is known as a standard of practice, competency, a code of ethics, or social media policy. Answer is social media policy. It's online on the internet. What is the meaning of the term scope of practice? In some states, it's used as the designation for practitioners rather than licensure, a process in which a person, an institution, or a program is evaluated and recognized as meeting certain predetermined standards to provide safe and ethical care. Most commonly defined by state law, this outlines the care you are able to provide for the patient or client, the where, when, and how a practitioner may provide services or function as a professional. A set of rules designed to address applicable state and federal laws as well as established business and professional ethical standards. A statement of intent that defines expectations and is implemented as a procedure or protocol. And the correct answer should be B. The most commonly defined by state law. This outlines the care you are able to provide for the patient or client, the where, when, and how a patient may provide services or function as a professional. The experience of reliving or re-experiencing a traumatic event as if it is occurring or is imminent is known as a flashback. Compared to a trigger, compared to CPTSD, complex post-traumatic stress disorder, or hyperarousal. Of the following, which is the best choice for a scope of practice defined as a service provided to enhance the health, condition, and appearance of skin, hair, and nails? Is it cosmetology, osteopathic medicine, naturopathy, or pediatric medicine? Should be cosmology. A blank, also referred to as a multiple relationship, occurs between a therapist and a client when additional relationship roles, such as friend or business associate, exist. Is the answer a professional relationship, a dual relationship, homeostatic relationship, or personal relationship? Should be dual relationship. Blank is a code of behavior that delineates expectations, behaviors that fall under the heading of good manners, cancellation notification, being punctual, hygiene, and personal habits. Is it competency as a code of behavior, etiquette, work ethic, or social media policy? And the answer is etiquette. What is the meaning of the term clinical supervision? A process of meeting regularly with a person who is trained in the skills of supervision to discuss casework and other professional issues in a structured way. A protective circle around the professional relationship that separates what is appropriate between practitioner and client from what is not appropriate. A group or individual process that helps participants set and reach goals. Usually there is one leader directing the activities and guiding the persons in finding their own inner strength to follow through on their dreams. or a group of colleagues who meet regularly to discuss common issues related to their professional lives, to share information and strategies, and to receive emotional support. And the meaning of the term clinical supervision is a process of meeting regularly with a person who is trained in the skills of supervision to discuss casework and other professional issues in a structured way. A blank is a transgression that may or may not be experienced as harmful. Is it a boundary crossing, a boundary, a transgression, or autonomy? May or may not be experienced as harmful. And the answer should be a boundary crossing. When a therapist honestly represents all professional qualifications and affiliations, they provide appropriate credentials by openly displaying certifications and licensing, create a trust so that the client has no doubt, assure clients by displaying your knowledge and using medical terms that they may not understand, should avoid the question asked by diverting attention to another matter. Provide appropriate credentials by openly displaying certifications and licensing. What is the meaning of the word sensuality? A state of disharmony between incompatible and or antithetical, which means directly opposed or contrasted persons, ideas, or interests. A clash or mutually incompatible. A state of consciousness in which we are more deeply relaxed, less aware of our thinking minds, and more open and vulnerable than we are in our day-to-day functioning. A physiological and psychological state of being awake, reactive to stimuli, or ready for activity. It involves the brainstem, the autonomic nervous system, and the endocrine system. The quality or state of being sensual, connection with the senses as opposed to the intellect, the awareness of body sensation, taking pleasure in sensation, and utilizing sensation to be more fully present in our bodies. And the last one is the answer. That's the quality or state of being sensual. Guys, I'm going to take a moment just to contact Varsity and let them know that I'm in the class, since we had like one interruption each to the first two classes. All right. What is the meaning of the word mentoring? An obligation or willingness to accept responsibility or to account for one's actions and consequences. A professional relationship in which a more experienced practitioner shares information, skills, and insights with a less experienced practitioner to provide encouragement and support. To withdraw support, especially in spite of duty, allegiance, or responsibility. The improper use, handling, or treatment, often to unfairly or improperly gain benefit. Mentoring would be a professional relationship in which a more experienced practitioner shares informed skills and insights with a less experienced practitioner to provide encouragement and support. What is the meaning of the term body language? A communication process designed to minimize misunderstandings in boundary discussions and to help in skillful responses to any challenge. It consists of 4 stages of increasingly forceful conversations. Wow. Sounds like verbal judo or something. When a communication is not clear, the message received by the listener can be very different from the message the speaker intended to send. Communicates undertones of anger through words, tone of voice, or both. Communication in which people reveal clues to unspoken intentions or feelings through physical behaviors such as posture, gestures, facial expressions, and eye movements. And it's the last one there. What is the meaning of the word intimacy? The action of understanding, being sensitive to, and identifying with another person's situation, feelings, thoughts, and motives. A close association with, detailed knowledge of, or deep understanding of a person. The psychological term of diverting the energy of a primitive impulse, especially a sexual one, into activities that are considered to be more acceptable socially, morally, or aesthetically. A criminal act of intentional deception by false representation of a matter of fact made for personal gain or to damage another individual. A close association with, detailed knowledge of, or deep understanding of a person. You guys just let me know if you have any questions or need clarification on anything. What is the meaning of the word hyperarousal? A physiological and psychological state of being awake, reactive to stimuli, or ready for activity. It involves the brainstem, the autonomic nervous system, and the endocrine system. A state of constant alertness to danger experienced by survivors of trauma. It is also described as a chronic state of fight or flight. A state of disharmony between incompatible or antithetical persons, ideas, or interests. A clash or mutually incompatible. A state of consciousness in which we are more deeply relaxed, less aware of our thinking minds, and more open and vulnerable than we are in our day-to-day functioning. Hyperarousal. That's interesting. A state of constant alertness to danger experienced by survivors of trauma, also described as a chronic state of fight or flight. Okay, so I just want to make a quick differentiation between some of the other answers and the correct answer, which they're defining as hyperarousal. So in the definition down below, it says hyperarousal is a state of constant alertness to danger experienced by survivors of trauma. It is also described as a chronic state of fight or flight. It's the same as the answer. Arousal is, and that's A, I think, a physiological and psychological state of being awake, reactive to stimuli, or ready for activity. It involves the brainstem, the autonomic nervous system, and the endocrine system. Conflict, it is a state of disharmony between incompatible or antithetical persons' ideas or interests. Altered state is a state of consciousness in which we are more deeply relaxed, less aware of our thinking minds, more open and vulnerable than we are in our day-to-day functioning. A blank is a focused group setting where the individuals in the group create specific goals for their business, career, and provide each other with support and inspiration for achieving those goals. A mastermind group is a focused group in which a setting where the individual in the group creates specific goals for their business or career. Peer group, a mentor, an online discussion forum should be a mastermind group. So they're defining down here below. Also, I think this one's a good one to read through. They're defining peer group as a group of colleagues who meet regularly to discuss common issues related to their professional lives, to share information and strategies, and to receive emotional support. So that's similar in description to the question, but the question is where individuals, the question reads, individuals, a focused group setting where the individuals in the group create specific goals for their business, career, and provide others with support and inspiration for achieving those goals. So that's a little bit more, a mastermind group sounds much more business, career oriented, and a little bit less like bringing up common issues related to the profession, right? Which could be not just business and career, but also clinical stuff. Might even be, how do I, as a massage therapist / entrepreneur / person who has a side hustle or a family, how do I juggle all that, right? Those kinds of things. And then mentoring is a professional relationship with a more experienced practitioner. So that's more one-on-one. And that's often more about skills and insights, like clinical skills. Insights into clinical skills or into patient management. Patient management means the expectations that patients have when they come in, or that clients come in. Sorry, in New York, I'm an acupuncturist. In New York, we can say clients or patients or whatever. I prefer to say clients for the most part, but it doesn't really matter. So sometimes clients have expectations that are not in alignment with how we want to provide care for them or with our policies. And that's something really helpful that a mentor can clarify. Client expectations. Online discussion forums. There are many free online discussion and support forums like Facebook and LinkedIn for various practitioners, where you can ask questions and you can get answers from many others in the same or similar careers. But that's different from a focused group setting, where individuals in the group create specific goals. You probably wouldn't create specific goals together through an online discussion group. Okay. Didn't mean to pick that apart too much. It's just, if I feel the answers are pretty similar, I may try to differentiate. What is the meaning of the term insider trading? A form of negotiated bribery in which a commission of money, goods, or services is paid to the bribe taker in return for a business favor. Financial gains that individuals may make based on information about company stock not available to the public. The process of getting a client's permission before proceeding with a healthcare treatment. Failure to provide the same care that a person with similar training would provide. And the answer is B, financial gains that individuals make based on information about company stock not available to the public. A blank is a systematic method or approach to gathering information about a client's condition and symptoms. And the answer should be, the choices are assessment, body language, arbitration, and attitude. And assessment is a systematic method or approach to gathering information about a client's condition and symptoms. The psychological strategies of relating to the world that are developed unconsciously to protect people from shame, anxiety, and other emotionally painful experiences that they are unable to handle otherwise is known as burnout, defense mechanisms, mediation, or sublimation. And the answer is defense mechanisms. Defense mechanisms are the psychological strategies of relating to the world that are developed unconsciously to protect people. What is the meaning of the word sexualization? Making an event, procedure, conversation, or experience into something that is sexual or could be interpreted as sexual. Steps taken to ensure that the treatment is not turned into a sexual experience for either the practitioner or the client. The psychological term of diverting the energy of a primitive impulse, especially a sexual one, into activities that are considered to be more acceptable socially, morally, or aesthetically. The four-phase cycle in men and women with distinct gender-specific physiological changes that occur in each phase. And it should be A, making an event, procedure, conversation, or experience into something that is sexual or could be interpreted as sexual. What is the meaning of the term code of ethics? Operating principles and behavioral guidelines that members of a profession are expected to uphold. Having requisite or sufficient skill, knowledge, ability, or qualities. A code of conduct that provides guidelines to those who post content on the internet, either as part of a business or as a private individual. The principle that practitioners always act in the best interest of the client. Oops. Code of ethics, operating principles and behavioral guidelines that members of a profession are expected to uphold. Refraining from the use of any mind-altering substance before or during a massage is considered to be conduct under what code of ethic? Is that client relationships, appropriate techniques, scope of practice, or professionalism? I would say that'd be professionalism. Yep.
I can barely hear you. It sounds loud over there. It sounds like you're at a.
That's just how the VIP section sounds.
I was like, it sounds like you're at a club.
Is that better?
Yes.
Okay. I can also turn the the audio settings up a little bit. Are you sure you can hear me okay? Can you hear me? Can you hear me all right? Okay. All right, so they're up pretty high. I guess that's okay. Let's try one notch higher. Test mic. Okay. Do you guys need to hear that question again? To prevent infectious and communicable diseases, the simplest, most effective way to minimize risk is hand washing. The CDC has 4 steps for proper hand washing. What is the second step? Rinse hands using warm water, rub hands together for at least 20 seconds to work up a lather, apply soap to hands, or dry hands with a paper towel. So the second step is rub hands together for at least 20 seconds to work up the lather. So let's take a look at the steps in order. Proper hand washing technique is number 1, apply soap to hands. That's C. Step 2 is rub hands together for at least 20 seconds to lather. That's B. Pay particular attention to scrubbing the backs of your hands, between your fingers, and under your nails. Number 3 is rinse hands using warm water. So that's answer A. And number 4 is dry hands with a paper towel. That's answer D. Use the paper towel to turn off the faucet, the light, and open the door before placing the towel in the garbage. These things are actually really important to consider. A lot of the surfaces, like the handle on the water spout or the handle on the door, those things are touched by hands before they're washed, right? And we do have to think about these things for sure. What is the meaning of the term learning styles? A labeling of signs and symptoms by a licensed medical professional, the identification of the underlying cause, etiology, pathology, or nature of a set of signs and or symptoms. A person's preferred method to take in information. The 3 most common are visual, auditory, and kinesthetic. A systematic method or approach to gathering information about a client's condition and symptoms. A group or individual process that helps participants set and reach goals. Usually there's one leader directing the activities and guiding the persons in finding their own inner strength to follow through on their dreams. Meaning of learning styles. It's a person's preferred method to take in information. The 3 most common are visual, auditory, and kinesthetic. What is the meaning of the term power differential? The role difference between a practitioner and a client, in which the client is vulnerable and the practitioner has more power by virtue of training and experience. A client or practitioner act out a specific situation as a way of becoming more comfortable with handling the situation in real life. The overlapping of professional and social roles and interactions between 2 people. A relationship with a client other than the contractual therapeutic one. A trusted colleague who provides guidance and education. A power differential is the role difference between a practitioner and a client, in which the client is vulnerable and the practitioner has more power by virtue of training and experience. What is the proper stance for giving a massage? Feet parallel to the table with weight on the back foot. Body properly aligned with the knees bent, shifting weight with the flow of strokes. Feet parallel to the table with the weight on the front foot. Knees and elbows locked with arms outstretched. Body properly aligned with knees bent, shifting body weight with flow of strokes. Okay. While acting in the massage or bodywork capacity, I will not tolerate any sexual advances from my client. This is in accordance to what code of ethic? Scope of practice, appropriate techniques, advertising claims, or client relationships. Client relationships. What is required of a licensed massage therapist after the license is issued? Renew state license and required insurance coverage every year. Obtain continuing education hours. No requirements. Answers A and B. And B answers A and B. Renew state license and required insurance coverage every year, and obtain continuing education hours, CEUs. The use of radiography to detect spinal subluxations and misalignment is within which scope of practice? Pediatric medicine, chiropractic, athletic training, or psychology? Chiropractic. A summary or outline of standards to which a massage therapist agrees to conduct their massage practices with a declaration of acceptable, ethical, and general principles of professional behavior is the standards of practice, code of policies, code of ethics, standard of regulations. That's the code of ethics. So let's just differentiate between standards of practice and code of ethics. A summary or outline of standards to which a massage therapist agrees to conduct their massage practices with a declaration of acceptable, ethical, and general principles of professional behavior is the code of ethics. Your school, state, liability insurance, and licensing or certification exams all have a code of ethics that are similar or very similar to that which you will need to adhere to. Standards of practice includes the code of ethics and is specifically defined in regards to professionalism, legal and ethical requirements, confidentiality, business practices, roles and boundaries, and prevention of sexual misconduct. Code of policies and standard of regulations are not terms utilized in massage. Okay. So standards of practice includes the code of ethics. Code of ethics is within standards of practice. That's the difference. And specifically defines professionalism, legal and ethical requirements, confidentiality. So HIPAA would be under the standards of practice, not under codes of ethics. Business practices, roles and boundaries, prevention of sexual misconduct. All right, any questions? Doesn't seem like it. So let's go on to some clinical stuff. Why don't we do, let's try kinesiology. Let's try. Oh, I made a video for that. Maybe we'll do this spine and thorax instead. Yeah, let's do that. I guess we can do the kinesiology 12. Let me just hit this video first. So I should really put this on YouTube. So it's 37 minutes long. We're not going to do the whole thing. I'm just going to skim through and show you what I think is important. So who do you know who says, oh, okay, at the beginning of his presentations? Who do you know? Ah, yeah, all this. Wow. Okay, I remember why I did this video now. It's because so much of the stuff that's in this particular section is a bit intricate. All right, so let's see. The trapezius muscle. Which muscle inserts at the spine of the scapula, the acromion process of the scapula, and the lateral 1/3 of the clavicle. So we're going to go over these specifics first and then go back and do the questions, because I think it'll help you remember the information a little bit better if you get like the specific explanations, the specific A&P review before we go over the questions, and then we can use the questions as kind of a way for you to self-test. So attachments of the trapezius muscle. All right. So the question was, which muscle attaches to the clavicle, the acromion process, and the lateral 1/3 of the scapula. So you can see that there's the trapezius muscle attachment right there, right? It's the trapezius muscle attachment right there, and this is the clavicle. And this here is the acromion. Let's just recall that the acromion is the extension of the scapula. But there are two extensions. There's the coracoid process, which is right here. Right? These are the same scapula and arm bone, just that this one is labeled with attachments of muscles. And this is the acromion right here, and this is the coracoid process. right? So we're looking at the scapula from the front, like this. This is the right arm scapula. So the trapezius muscle attaches here, and then there should be an attachment for the trapezius muscle. Yeah, we're gonna have to look at it from behind, I think. Lateral 1/3 of the, oh, I see, lateral 1/3 of the clavicle, okay. Spine of the scapula, acromion process, and lateral 1/3, my mistake. Spine of the scapula, where is that graphic? Again, just slow down a little bit. Spine of the scapula is in the posterior. Here we go. So the trapeze, so this is the same scapula, the right scapula and arm from the posterior, and they're showing the attachment of the trapezius muscle here at the spine of the scapula. So again, it's the parts of the shoulder scapular complex include the clavicle, right, in the front, and then here's the coracoid process projecting to the front. Oh no, I'm sorry, this is the acromion process. Here's the coracoid down here. And this is the spine of the scapula. Let's see, what else do we have? No questions, okay, that's the trapezius. Okay, yeah. All right, so maybe we won't do that particular one right now because that's going to require a little bit more discussion. Okay. Let's keep going. So while we're here in the posterior aspect of the scapula, I want to point out two other things. So we're looking at the scapula from the back. The first thing that I want to point out, which is going to come up in one of the questions in this section, is what muscles attach to the lateral border of the scapula versus the medial border of the scapula, and the lateral. So let's just look at these. I don't think that they asked about the triceps brachii muscle, the long head, but that's useful to know. And that's on the lateral border of the scapula. And then the teres minor muscle, which attaches here and then goes over here. You see this teres minor, right? There's the teres minor muscle right there, and there's the attachment on the lateral border of the scapula, and then the teres major muscle, right? And then there's an attachment here right at the inferior border or the inferior tip for the latissimus dorsi muscle. It's not called the inferior tip, only I call it that. The tip of the scapula, the latissimus dorsi muscle, and that's really important because the lat attaches not only to the scapula but also to the humerus, and it has fascial attachments all the way down onto the lumbar spine and the ilium, which is the hip bone. And then if we come around from the tip of the scapula onto the medial border, you can see that there's also muscles for the teres major attachment on the medial aspect, although most of them are on the lateral aspect. Also on the medial aspect are rhomboid major and rhomboid minor on the medial aspect, and levator scapula on the medial border. Okay, and then there are these small little platforms where different tendons attach, and I just want to point out right now, we'll look at them more closely, but from posterior it's the teres minor, followed by the infraspinatus, followed by the supraspinatus, coming around to the front, and then all the way in the front you would see the biceps tendon. So we're going to take a look at those in a minute. That'll become clearer to you momentarily. Oh, here's the supraspinatus muscle we just looked at from the back, right? Supraspinatus from the back. Okay, I'm not seeing it, but hey, you've got it on video. Here's the supraspinatus aspect from the front. here's the biceps tendon groove, and here's the subscapularis muscle. So this is gonna be important because it's gonna come up later. So the subscapularis has an attachment at the anterior aspect of the humeral head. There's a groove for the biceps tendon, and then there's going from front to back, from anterior to posterior. So there's the supraspinatus. Behind that is the infraspinatus, and behind that is the teres minor. Doesn't make any sense that I can't find that easily. Just double the speed as a way to, yeah, there we go. Double the speed as a way to scrub. Okay, so we're seeing this from a different angle, right? And what we're looking at is the head of the humerus again, and we're looking at kind of instead of a front and back view, we're looking at like from the side at a quarter angle. So this one over here, A is looking at the shoulder. It's looking at the shoulder like this, right? So it's like a quarter angle from the side, quarter angle from the front, right? It's neither anterior nor posterior. It's like a quarter from the front, quarter from the side. And then the one next to it, B, is like a quarter from the back. So as you start to walk around from the front toward the back of the shoulder, yeah, good. I'm glad to see you're palpating. Good. As you start to walk around, the subscapularis attachment that's on the front of the humerus becomes obscured, and the teres minor and infraspinatus attachments that are on the back become visible. And we'll look at that again. Let's just scrub through this. Oh yeah, notice that that the fibers of the trapezius, they attach to the scapular spine. The scapular spine is visible between the fibers of various muscles here, the trapezius and the deltoid, and that the directions of the fibers, they move different directions in order to attach to different vertebrae that may be higher up, adjacent, or lower down. And of course we have the upper, the middle, and the lower trapezius muscle showing there. Also, see if you can visualize the inferior border or the tip of the scapula, right? Would be right about here, and notice that the latissimus dorsi is overlapping that. Here you can see the teres minor muscle, and here's the teres major muscle. You can't see the attachment of the teres major muscle because it's anterior or in front of the tricep muscle. Okay, just want you to notice that there are, oh, this is like a lousy view. Let me see if I can, okay. Okay, so take a look at this is the brachial plexus, and let's just take a look at the structures that are in this area. So we have a bunch of these nerves. They're not going to ask you like which specific nerves are coming out, right? But you have to notice the structures that are overlapping them, right? So it's the clavicle is over top of them, and you have this pectoralis major muscle that's reflected, that means cut and peeled away. And then the suprascapular artery and nerve pass down under the clavicle, where it splits off to become the musculocutaneous nerve, the ulnar nerve, medial cutaneous nerve. There's a bunch of them, right? But this is all known as the thoracic outlet. Did I say, I hope I said thoracic outlet earlier. That's what that is. I think maybe I said brachial plexus, which is not incorrect, but I want you to remember that's the thoracic outlet. And if we just rewind, there it is. If we take a look at the same area where the thoracic nerve is coming out, you have to remember that the scalenes, that's the anterior scalene, and then the middle scalene, and then the posterior scalene, right? Anterior, middle, and posterior, that they all overlap the thoracic outlet. Okay, there was a question I think about like which muscles do the anterior border of the upper trapezius touch? This is like, you know, not a bad thing to remember. Remember we had that like posterior triangle, which had the like anterior border of the SCM as the front of the triangle and the clavicle as the bottom. And the question is which muscles are in there, right? And the choices are, you know, is it the sternothyroid muscle? Is it the sternohyoid muscle, right? Is it the SCM muscle? Is it the splenius muscle, levator scapula, scalenes? There's all three scalenes right there. And then this muscle right there, what is that muscle? Hopefully we won't have to. Yeah, which muscle groups are located between the SCM and the anterior flap of the trapezius? So they ask you, is it the levator, the suprahyoid, and infrahyoid? It is levator, but not the suprahyoid, infrahyoid, right? Is it the scalenes, the spleni, and the levator scapula? Is it and it is it the spleni, splenius capitis, splenius cervicis, levator scapula, and suprahyoid? Not the suprahyoid, not the infrahyoids. Scalenes and levator scapula. So it's only B has the correct answer. Let's just look at it one more time. So it's the splenius muscle. So it's the spleni or the spleni, with a double I was asking about. So that's like splenius cervicis, splenius capitis. So here's one of the splenius muscles. They're not labeling it which one. And there's the levator scapula in front of that. And in front of that is the scalenes group. Okay, let's keep on trucking. Yeah, we're making like not bad time. You guys can go watch this video. Yeah, again, just showing that the brachial plexus or the thoracic outlet passes among the scalenes. I'm sure that the discussion that I'm giving on the video is like, you know, just like enrapturing. Anyway. Prevertebral muscles. Okay, there I'm just showing you some of the other muscles like the omohyoid, so that we can be clearer on where those are. Which muscle stabilizes the rib when the scapula is fixed in one position? This is a really tricky question. So when the scapula is fixed in one position means it's not moving, right? So the person is, you're consciously either elevating the scapula up like this, depressing the scapula down like that using your levator, protracting the scapula out away from each other, protracting away, or retracting together. Right. Let's just listen to what this says. Don't worry, I'm not going to rely on the video to teach the class, but this is a little complicated. Can you hear that? Can you guys hear that?
I don't think so yet.
Do you guys hear that? Larissa doesn't hear it. Crystal, do you hear it?
I don't think I can hear that yet.
Okay, okay, let's see. Edit, floating, meeting controls, screen sharing. Use the shared desktop one, advanced shared computer audio. That should fix it. Main function is, you hear that? You got it, Crystal?
Mhm.
What?
I don't know. Is it supposed to be like the video clip you said? Yeah, I don't.
Okay, I'm gonna hit play. Tell me if you hear sound. To move the shoulder down,
Okay, now I can hear it.
down and Okay. forward.
Yeah.
Okay, so let's back up just a little bit and let's explore this. By the way, have you guys, maybe I'm totally boring you. Have you ever thought about which muscle stabilizes the ribs when the scapula is fixed in one position? Have you thought about that? Just a quick yes or
Um,
no will be fine, thank you. No?
yes, I know which one it is, but
Which which one is it?
I'm sorry, I almost forget the name of it off the top of my head.
Okay, all right. Well, let's take a look at which one it is and why. Right, it has to do with the attachments to both the ribs and the scapula, and I believe it there's also a relationship between which muscles become active at the end of the inhale or at the end of the exhale. It's here on the video. It's which muscle stabilizes the ribs? Well, the choices are pectoralis major, trapezius, serratus anterior superior, and pectoralis minor. I immediately chose serratus anterior superior because it's the one that I knew has a lot of attachments to the ribs. Turns out that's incorrect. It's the pectoralis minor. So this is a little tricky, and let's go over it. So the correct answer is pectoralis minor. Now, the pectoralis minor muscle attaches to the coracoid process of the scapula, so it is part of the scapula, and it therefore controls some of the movement of the scapula. And I think some of the fibers attach to other aspects of the scapula, like the anterior aspect of the scapula, but it'd be the lower fibers, and it's not pictured. And then they extend down onto the costocartilage junction of ribs numbers 3, 4, and 5. So it goes from ribs 3 through 5 up to the coracoid process. Now, what that means is that the pectoralis minor, its main function is to move the shoulder down and forward. So its main function is to draw the scapula out to the side and then forward, like rounded shoulder posture, and then down. In that position, that's very similar. That's almost exactly shoulder blade protraction, right? Mm-hmm. Remember, shoulder blade retraction is shoulder blades together. Shoulder blade protraction is shoulder blades all the way apart. If you add a little depression to that, shoulder blades apart and shoulder blades down, you get the full contraction of the pectoralis minor. Now, it turns out that when the pec minor is contracted like that, is pulling the scapula into protraction and depression, pulling it out and down like super rounded computer at your desk posture. It turns out that they become very active during forced inhalation. So let's see if I can find that. It says when the scapula, just a minute. When the scapula is fixed in elevation by the upper trapezius and, oh, I'm sorry, I misspoke. It's not downward. Okay. So first of all, the pec minor. Let me back up. The pec minor contracts when the scapula is brought into protraction and depression. Mm-hmm. That's like walking with a pair of crutches, right? Imagine pushing your hands down onto a pair of crutches and lifting your body weight up out of your feet a little bit and pushing into the crutches, right? Really using your shoulder strength and pressing down toward the ground. then you have the activation of the pectoralis minor. Now, if you take the shoulder blades the opposite way, take them up towards your ears. If you take them up towards your ears, then what happens when the scapula is in a fixed elevation by the upper trapezius and levator scapula, the pectoralis minor becomes active during strong inhalation that involves the upper chest. So if you raise your shoulder blades up towards your ears and you touch the pec minor muscle right under your clavicle and you take a deep breath in, at the end of that deep breath, you can feel your pectoralis minor muscle starting to contract. So what that means is that when the scapula is elevated, your shoulders are shrugging upward. In that position, the pectoralis minor starts to pull on the ribs at the end of the inhale. So that's what the exam means when it says, that's what the question means when it says when the scapula is in a fixed position, which muscle stabilizes the ribs? Which muscle stabilizes the ribs when the scapula is fixed in one position? It's not a very good question because it's not telling you which position, right? There's more than one muscle that goes from the scapula to the ribs, but okay, just a little bit. Let's just pick like one more, because I don't want to spend all my time on this. Or all of our time on this, rather. Okay, so this question, which muscle? Oh, no. There's one aspect of the pec minor versus the pec major that I want to show you guys, and that is that the pectoralis major attaches to the sternum and then to the humerus, right? And the pectoralis minor attaches to the ribs 3, 4, and 5 and the acromion process. Acromion process or coracoid process? It's the acromion or the coracoid? I should clarify that now. So one of the questions or problems that I ran into, this is the serratus anterior. This is another muscle that attaches at the ribs and at the scapula. So that's the tip of the scapula, the inferior border of the scapula, right? And it attaches to several of the ribs. One of the questions that I ran into with more than one student is the pectoralis major and the pectoralis minor, they should be relatively similar, and it's confusing to some students that the attachments can be so different, but in fact they are really different. So I just wanted to look at that back to back. So the attachment of the pec minor is from ribs 3, 4, and 5 to the coracoid process, right? And the attachments of the pec major are from the not from the ribs at all, and not to the coracoid at all, but from the sternum, part of the clavicle, and then the humerus. So that's really pretty different. And we think of the pec minor as like so similar to the pectoralis major that it's a pushing muscle. In fact, it's not really. It has more to do with like pushing downward and pushing forward in a downward position than it does with pushing straight forward like the pectoralis major muscle. Although the pectoralis major can be accessed by pushing downward as well, because it has these upper attachments up here at the clavicle. Okay, so let me just do a quick skim and see if there's anything else. Okay, I guess I'll just tell you about this. This is the quadratus lumborum muscle. Notice that the QL attaches to the iliac crest, goes up to the 12th rib, and it also has projections that go to the transverse processes of vertebrae L1 through L5. Remember that vertebrae have a transverse process on each side, and they have a spinous process right on the back. Yeah, we covered this in the beginning, which muscle attaches to the inferior angle of the scapula, which muscle is attached to the medial border of the scapula. Okay, let's review this just once. Let's review the, just a minute. To the lateral and posterior aspect, the back of the humerus, and it attaches on the back of the humerus. And here's the greater tubercle, that's the bump, greater tubercle of the humerus. Okay, so two of the terms that were confusing to me and confusing to some other people are the greater tubercle and the lesser tubercle of the humerus and the attachment sites around them. Here's the infraspinatus tendon. Down here is the teres minor. I'm going to go over all this again. And here's the greater tubercle. It's not labeled. Here's the greater tubercle. Notice here's the supraspinatus tendon. That'll become important a little bit later. Okay. Imagine that you're standing at the side of the patient. You're looking directly at their side, at their shoulder. If you take a small step toward the front, around to the front, so you're now looking at part of the front chest, the pectoralis area, it'd be right here, and you're seeing the front and side aspect of the shoulder. That's what you're looking at here. Excuse me. This large bump here is the greater tubercle, and the smaller bump here is the lesser tubercle. Yeah, right here. This is the lesser tubercle. The subscapularis is not on the lesser tubercle. And then there's no, the subscapularis is on the lesser tubercle. And then there's a value. Okay, so the MBLEx question pertains to which muscle attaches to the lesser tubercle of the humerus and which muscles attach to the greater tubercle of the humerus. And an easy way, not an easy way, but the way that I like to remember the difference between the two of them is that the lesser tubercle, which is in the front, and the greater tubercle, which is on the side, are divided by the biceps tendon groove or the bicipital groove. And in the front, the lesser tubercle has the attachment for the subscapularis muscle, and on the side and the back, the greater tubercle has the attachments for the supraspinatus, the infraspinatus, and the teres minor. So you just have to remember that the subscapularis muscle attaches to the front, to the lesser, and that the lesser tubercle is in the front, and that the other muscles, the other sits muscles, attach to the greater tubercle, which is on the side and in the back. And a pretty good way to remember that is to remember the function of those muscles. So remember that the infraspinate, or the the subscapularis muscle, which is on the front aspect of the scapula, right, attaches to the lesser tubercle right about here of the humerus. And a good way to remember that is that the fibers are going to pull the arm like this into internal rotation, right? So it makes sense that the fibers would attach on the lesser tubercle in the front of the humerus, because they would have to rotate the humerus internally. The other muscles, like the infraspinatus and the teres, they attach to the posterior aspect, so they would rotate the head of the humerus posterior, right? They would externally rotate the head of the humerus. And then the one in the middle, the subscapularis, that has more to do with elevation. It has elevation, and it also shortens maximally if you internally rotate the supraspinatus muscle, infraspinatus, and then teres, infraspinatus and teres, infraspinatus and teres, right? And then subscapularis muscle. All right, so let's go through these questions. Watch the video. It's worth watching. I did that so that people could just go through and get that over with, for lack of a better term. That's like a pretty deep dive. Okay, let me see if I can get the where's like the floating medium controls. Oh, it's 7:05. Do you guys want a break? You okay to go for a few more minutes?
Yeah, that's fine. I mean, whatever you need to do, I'm okay with.
Let's just do a few and then take a break. All right. This is kind of odd. I don't remember. I don't remember what all that is. You do? Are we? Why am I getting this view? Okay, whatever. All right, so I'm not going to see you for a minute here because how I'm positioning the screen because your elderly professor cannot remember how to configure Zoom. How does this thing work again? So here we go. Let's do a few questions. Which muscle inserts at the spine of the scapula, the acromion process of the scapula, and the lateral 1/3 of the clavicle? And remember that was the trapezius muscle. And down here they just tell you the trapezius muscle inserts at the spine of the scapula, the acromion process of the scapula, and the lateral 1/3 of the clavicle. Which muscle draws the scapula to the posterior, the scalp? Which muscle draws the scalp to the posterior aspect? And that's the occipitalis muscle. Let's just look at one or two more of these. Let's see, the galea eponeurotica stretches across the top of the cranium, joining the occipitalis and the frontalis muscle, which equals the occipitofrontalis. So they don't tell you about the temporalis or the buccinator, which is in the jaw, or anything else, but that's okay. What three muscle groups are located in between the SCM and the anterior flap of the trapezius? Between the SCM and the anterior flap of the trapezius. Again, it's not the suprahyoid or infrahyoid, right? It's not the infrahyoid. Yeah, it's the scalenes, the spleniae muscles, and the levator scapula. Which muscle stabilizes the ribs when the scapula is fixed in one position? Is it the pectoralis major, the trapezius muscle, the serratus anterior superior, or is it the pectoralis minor? Who would like to answer that?
Can you reread the question? I'm sorry.
Yes. Which muscle stabilizes the ribs when the scapula is fixed in one position? Is it the pectoralis major muscle, the trapezius muscle, the serratus anterior superior, or the pectoralis minor?
Pec minor.
Ding 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 ding. Awesome. Pectoralis minor. Okay. And remember, the position they're talking about, that they're referring to, is actually with the scapula elevated. It'd be nice if they gave you that, but that's overly specific, that thing. But hey, our job is to try to prepare. Which muscle inserts at the transverse processes of the lumbar vertebrae and the 12th rib? Which muscle inserts at the transverse processes of the lumbar vertebrae and the 12th rib? We looked at it a moment ago. Does anybody want to answer this? Serratus anterior posterior? Don't say that one. Quadratus lumborum, internal oblique or external oblique? Does anybody want to answer this? No.
Oblique.
It's actually the quadratus lumborum muscle. So the difference is, I don't know if I can, let's see if I can pull this up quickly enough to, how do I do open in a new, oh, crap. Yeah, take a look at it, please. It's actually the quadratus lumborum muscle. Alrighty. Yeah. Oh, let's read this. Quadratus lumborum muscle originates at the posterior iliac crest and inserts on the 12th rib and L1, L4 transverse processes. It is sandwiched between the thoracolumbar aponeurosis and the erector spinae group, the ESGs. Interesting to note, this muscle is the deepest of the abdominal muscles. The actions unilaterally are to laterally tilt or elevation of the pelvis, lateral flexion of the vertebral column to the same side, can also assist in vertebral column extension. The bilateral action of the QL is to fix the 12th rib during forced inhalation and exhalation. Okay, let's take a little break for like, let's go for like, we've been pretty focused. Let's take a break for 7 minutes. So come back at 7:18, okay? See you guys in a bit.
Cool, because it was so intricate to look.
Yeah, well, the attachments at the greater and lesser tubercle of the shoulder, they're really fine detail aspect, right? So I mean, I almost never think that way clinically. Like if somebody says, well, the pain is kind of on the front and the side of the shoulder, I know it's one of these three muscles, and then I treat all three of them looking for what's tender and focus most on the one that seems more reactive, right? Or where the range of motion is limited. So to think like, okay, which facet joint on which tubercle, I think, they're just, in my opinion, that's just like being nitpicky. But our job in MBLEx prep is to prep for the exam, right? Not to be able to treat people's shoulder pain. Which is like, you can be good at taking the exam, but not be great at treating the shoulder pain, or vice versa.
Yeah, it's opposite for me. It's like I'm good at like more of the physical action aspect, but then the like test quiz stuff is like harder for sure.
Yes. Taking the test is definitely its own assignment, definitely its own skill. Okay, let's move on. Which muscle does not insert onto the humerus? Please get this one. Is it the supraspinatus muscle? Is it the levator scapula muscle? The infraspinatus, or the latissimus dorsi? It's the levator scapula. Remember, the latissimus dorsi has attachments on the humerus. You can always think about your lat as like the pulling muscle. Do you guys need to see a graphic of the latissimus dorsi attachment? I can see you speaking, Larissa, but I can't hear you. Do you guys need to see? No? Okay. All right. There are three types of muscles in the human body: visceral, skeletal, and epithelial. Skeletal, cardiac, and smooth. Long, short, and cardiac. Nerve, epithelial, and skeletal. Three types of muscles. Okay, I'm curious because some of these answers are like really far off. So I'm curious, Larissa, what do you think? Larissa.
I don't know.
Oh, okay. All right. Great. Crystal, do you know?
I wanted to say visceral, skeletal, and epithelial.
Okay. Great. Fantastic. Okay. So, visceral. So, Crystal, visceral refers to what? Viscera are the what of the body?
I am not remembering the full definition of that one, but I know the skeletal and some of the epithelial back from anatomy.
Okay, Larissa?
I mean, like the word visceral is not, unfamiliar, but it's just I don't remember the image that it came with back before.
So viscera, Larissa, do you know what viscera, it rhymes. Viscera, you know what that is? Okay, so the viscera are the organs, the internal organs. So viscera, there might be some visceral muscle, but no, it's actually not called visceral muscle, okay? Skeletal refers to the skeleton. The muscles do move and stabilize the skeleton, definitely. But epithelial, what does epithelial refer to? That refers to a cell layer. Cell layer. Yes, so that is not a type of muscle. Skeletal, cardiac, and smooth, that's the answer for sure. Skeletal muscle that moves the skeleton. Smooth muscle is the type of like involuntary muscle that you find in many of the viscera, except for the heart and the uterus. Those have a type of segmented muscle or a type of striated muscle, which is also involuntary. Maybe we should take a look at, let's take a look at the difference between skeletal muscle and smooth muscle. Let's see. Let's try, if it's not in here, I'll just look it up for you and I'll stick it in there.
I mean, I can see, by the way, why cardiac would be a muscle because it's the heart.
Yes, and it's a
Yeah.
unique type of muscle. You know, because we usually think of skeletal muscle as being striated and smooth muscle as being non-striated, right? And involuntary. Skeletal muscle is voluntary. The muscle in the viscera is involuntary and smooth or non-striated, but the muscles of the cardiac, the muscles of the heart, cardiac muscle, is actually striated. Okay, so it's neither smooth muscle nor skeletal muscle. It's somewhere in between. It's skeletal-like muscle that's involuntary, similar to smooth muscle. So let's look at the difference between skeletal versus smooth muscle. We don't have to get like too deep into this. A lot of this stuff is like really abstract. Here, let's go up here to the images like that, and let's just blow this up. Okay, perfect. So the skeletal muscle, you can see like Z lines. See that Z? You can see Z lines. And then smooth muscle, you can see individual cells with nuclei, right? And then cardiac muscle, you can see also is striated, right? So striated muscle for skeletal and cardiac. Smooth muscle is not striated. And let's see if there's any. Oh, this looks like it might be a good one. Like only a nerd says, "Ooh, this might be interesting." So here we go. Skeletal muscle, right? You can see there are lines on the skeletal muscle, right? The striations, yeah. And then the smooth muscle, there's no striations at all, right? And then the cardiac muscle, there's actual striations, similar to the skeletal muscle. Let's compare. This might be irrelevant, but let me just compare cardiac muscle versus uterine muscle. So here also is a nice graphic. So this is not the uterine muscle, but this is showing you that the skeletal muscle is striated. Cardiac muscle is also striated. The smooth muscle is not striated. Let's look at. Let's try myometrium, which is the muscle of the uterus. Where is Wikipedia? Wikipedia is all right. So I'm not able to find an answer right away, but I thought that the structure of the uterus and the that myometrium or the uterine muscle and cardiac muscle are very similar. But I'm not seeing striations on any of the myometrium muscle. Okay, I wish I could spend more time on that because it's interesting. But yeah, it definitely looks to me like this is not striated. Okay. Okay, we have to move on, much to my chagrin, because I'd rather spend time on stuff that's answering questions that I think are interesting. Okay, so then long muscles, short muscles, cardiac muscles, that's just a distraction. Nerve, epithelial, or skeletal, those are types of tissues, right? So like skeletal muscle or skeletal tissue, right? Epithelial tissues, epithelial cells, nerve tissue, nerve cells, right? Which of the following body systems is in charge of muscular development? Muscular development. Remember we had a question like this earlier about like, is it the pituitary or the testes and ovaries, the gonads, right? Which of the following body systems is in charge of muscular development? Is the nervous system, the endocrine system, the digestive system, or the lymphatic system? Well, they all work together, but for the most part, it's the endocrine system, because that's the one that secretes, you know, human growth hormone and luteinizing hormone, and then that results in testosterone and estrogen. By the way, testosterone and estrogen, are those catabolic or anabolic? Larissa, testosterone and estrogen, do they build up tissues or do they break down tissues?
Build up?
They build up, that's right. And so which prefix which word means building up? Anabolism, anabolic, or catabolism, catabolic? Anabolic or catabolic?
Anabolic?
Anabolic. Did you say anabolic? Yeah, that's right, anabolic. Yeah. Catabolism, like catastrophe, like breaking down. Which of the following body systems functions is to provide movement and maintain posture? That's pretty interesting because it's a little unclear now, right? Endocrine system, skeletal system, muscular system, or nervous system. So I think it's either the skeletal or the muscular system. So which one is it? Movement and maintaining posture. What do you guys think? Is it the skeletal or the muscular system?
Muscular.
Yeah, definitely. And why is the answer the muscular system and not the skeletal system? Isn't the skeleton related to posture? And doesn't it allow for movement, like movement of the joints? Yes. Yes, that's true. But it's the muscular system which actually moves the skeleton. Okay, anyway. Yeah, questions like that are interesting because they're tricky. All right, is there anything you guys want to see from this section, Kinesiology 12? Anything you guys want to see again? I made a whole video for this section because this section like was a little bit too in depth. Okay, we have about like 24 minutes left. Let's just do a little joint movement. So here's some joint movements that are more general, like basic. I guess she didn't like the class. Like basic joint movements, and then like more specific joint movements. And if you click on this massageschoolnotes.com/joint movements, you will find a deeper explanation of and description of like flexion, extension, abduction, adduction, etc. Okay, but here I've just listed them for you, right? So if you just go over this list on a regular basis, this is in the recommended study materials in the MBLEx folder, which I've shared with you. So among all the documents, you scroll down and you'll find recommended study materials. And if you open that, on the first page, there's joint movements, right? Okay, so flexion and extension. Remember that flexion brings two bones closer together, and then extension brings two bones farther apart. So you have elbow extension or arm extension at the elbow, arm flexion at the elbow, and then extension. And then also you can also have flexion and extension in the knee, right? So that's knee flexion, knee extension, or leg flexion at the knee, right? And then you have that also at the hip joint, right? So here's my hip joint, here's the top of my hip, right? So you have flexion through the hip, and then you have extension through the hip. Now you also have things like extension and flexion at the wrist and at the foot, but they have different names, right? So dorsiflexion versus plantar flexion is the term used for the foot, so that's dorsiflexion, like toward the dorsum of the foot. Plantar flexion toward the plantar surface of the foot. Dorsiflexion and plantar flexion. And let me see about the wrist. I think the wrist actually is just called extension. Yeah, wrist extension and then wrist flexion. So that is basically the same as the elbow and the shoulder and the hip and the knee and the neck and the spine, right? You also have it in the neck and the spine, right? Flexion, extension, right? And then flexion. Okay, and then abduction versus adduction. Please get in the habit of saying abduct versus adduct, right? So when you abduct or abduct, here's my midline, yeah, from the nose all the way down to the belly button and beyond, right? So when you abduct or abduct, you're taking something away from the midline, right? So my arm, my forearm, my elbow, my humerus are all abducting right now, right? And then when you adduct, you add toward the midline, right? And the same for the leg, right? So you have adduction where my knee, here's my right knee and my left knee, here's the midline. My knee is adducting or adding toward the midline, and now it's abducting, abducting away from the midline. Okay. So, and then for the wrist, whether the hands are shown this way in anatomical position or this way in prone position, do we say adduction and abduction, or do we say adduction and abduction? Right? Do we say those? No, we don't. We say deviation toward the ulna, ulnar deviation, radial deviation, and ulnar deviation, right? So that's unique to the wrist. That allows us to have the hand in any position and to understand which way the hand is moving or which way the wrist is moving the hand relative to the forearm. Ulnarly, ulnar deviation, or radially, radial deviation. Okay, then there's some more under this title, some more specifics. We find that there's a lateral flexion, right? So, and that's for the neck and the spine. So there's flexion of the neck, but there's also lateral flexion. So this is the closing of the joints. The bones are coming toward each other in lateral flexion, and then there's a return to neutral, right? This is not called extension. We would from here not say extend your neck, we'd say return your neck toward neutral or out of lateral flexion, right? And then horizontal abduction, abduction, right? Remember, abduction is going away from the midline, right? So here's the horizon, right? So this is horizontal abduction, right? Horizontal abduction, and then horizontal adduction, and that's especially useful for the shoulder compared to having a shoulder that is not flexed, right? compared to this kind of adduction, or this kind of abduction, right? Okay, and then diagonal abduction and diagonal adduction, which is down here. Again, that's the shoulder, so that's diagonal abduction, and then diagonal adduction, adduction. So here's the midline. So adduction, diagonal adduction, and diagonal abduction, diagonal abduction. I like this definition. I made a short video of it, which I think is on the MBLEx playlist. Circumduction is a combination of abduction and adduction, so abduction and adding, adduction, also flexion and extension of the shoulder, and also rotation, right? So you have some rotation, internal rotation with abduction, and then flexion, hello, and then you have some internal rotation there, hello, and then abduction through extension, and then back down to neutral. Right? A nice way to think of circumduction is that if the joint moves with like a cone shape or a Christmas tree shape, the point of the cone, the point of the Christmas tree is the center of the joint, right? So right now, my hand is drawing like the wide base of the cone, the wide circle of the cone, and my shoulder is just staying like in the same place, right? It's like the point of the cone. And right now my fingers are drawing like the wide base of the Christmas tree, and my wrist is like the point of the Christmas tree, right? And now I'm doing it through my elbow, circumduction, and you can circumduct the neck and head, right? Where this is the point of the cone, and the cone is being drawn here. You can do that through the hip, you can do that through the ankle. Circumduction, okay. Oh, these terms are really great. Orientation. Do you want to, if you want to do any more basic joint movements, we can keep doing those, or we can move on to orientation.
We can move on to orientation.
Okay. So orientation. So these are like always rusty for people until they're not. So distal and proximal, especially useful. Distal and proximal are relative. All right. So here's the humerus, and here's the forearm. This is also called the upper arm and the lower arm, right? So on the humerus, this is proximal, which is toward the body, right? Proximal means towards the body. Distal means towards the terminal end, like toward the finger or toward the toes, right? So this is proximal and this is distal. Yet the humerus in its entirety is distal to the forearm. The humerus in its entirety is proximal to the forearm. The forearm is distal to the humerus. The forearm is more distal than the humerus, right? Let's see, the epicondyle of the ulna is on the distal end of the ulna, right? And then the whatever this is called, part of the ulna, is on the proximal end that connects to the humerus, right? The wrist attaches to the distal end of the radius, and the humerus attaches to the proximal end of the radius. The radius attaches to the distal end of the humerus, and the humerus's proximal end attaches to the shoulder joint. All right, now the lower limb is your job. Okay, so the foot, is the foot at the distal end of the tibia or the proximal end of the tibia?
The foot is distal.
Yes, very good. And which one is at the proximal end of the tibia? Is it the plateau of the tibia, or is it the medial epicondyle of the tibia? No, trick question. I'm sorry. Is it the plateau of the tibia, or the medial? What is that thing called? The bump on the inside of the ankle.
Okay.
Yeah.
Okay. So what was the question again?
The question was poorly worded, is what it was. Which one? which one is at the proximal end of the tibia? Is it the plateau of the tibia, or is it the medial aspect of the whatever this thing is called here? Let's see. Medial ankle bone is called the malleolus. Is it the plateau of the tibia or the medial malleolus? Proximal end of the tibia, which one? The plateau of the tibia or the medial malleolus?
Medial, the second one.
No, you got to give me the whole word. Because on the test, you can't be like, oh, I think it's the second one. Which one was that?
Pronounce it again, please.
Okay, which one is at the proximal end of the tibia? Is it the plateau of the tibia or is it the medial malleolus?
Malleolus.
Malleolus. Okay.
Malleolus.
Okay, let's look at the anatomy. All right. So here's the tibia. Okay. Yeah, here's one. All right. Can you see this pretty clearly? All right. So this is the plateau of the tibia, right? Where it connects to the femur. And this is the medial malleolus, which is the inner ankle bone. And over here, can you see this?
Yeah.
Over here, this is the plateau of the tibia, and this is the medial malleolus. So one is proximal, the plateau of the tibia or the medial malleolus? Which one is proximal? Closer to the body.
Okay.
Which one?
The
plateau or the medial malleolus?
Yes,
the plateau, yeah.
Yeah.
Okay. All right. Which one is distal? Which one is distal? Is it the patella or the medial malleolus?
Medial malleolus.
Malleolus. That's right. And how do you spell foot again? Bones of foot. So which one is there's the navicular bone, right? And here's the first metatarsal. Which one is proximal? The navicular bone or the first metatarsal?
Navicular bone.
The navicular bone, that's right. What are these bones here called? What are these called?
Phalanges.
That's right, phalanges. What's the name of, see there are 3 bones here,
Huh?
right? And there are 2 bones here, 2 phalanges here, 3 phalanges here, 3 here, 3 here, 3 here. So what's the name of this bone? Proximal, distal, or intermediate?
Media. Proximal. All right. Say that again.
Is it the proximal phalange, the intermediate, or the distal phalange?
Intermediate.
Count the bones again. 1, count with me. 1,
1. Oh, okay.
3.
Okay.
See?
I was counting
Right.
the red one. I'm sorry.
Yeah. Well, if I zoom out a little bit, you can see these 4 bones and these 4 bones and the navicular bone, right? These are the bones of the midfoot, right? So that's a different section than the bones of the forefoot, which are made up of the metatarsals and then the phalanges, right? So let's do a little like repeating so that we're using that part of our brain, right? So the forefoot is made of the metatarsals and then the phalanges, right? So just repeat that to yourself, and then of the phalanges, the big toe or the great toe has 2 phalanges, and toes 2, 3, 4, and 5, they have 3 phalanges. 2 phalanges on the big toe, 2 phalanges on the great toe, 3 phalanges on the other 4 toes. So then there's a proximal phalange, right? And then what would the one on the end be called? Proximal, intermediate, or distal?
Distal.
That's right. And the one between the proximal and the distal phalange would be called what?
The medial.
The intermediate. Yeah, the intermediate. Or the middle phalange, right? And then the big toe just has what? What kind of phalange? Proximal, distal, or intermediate?
Are you asking what this one is? The one
Yeah,
that-
what's the name of that one? Proximal, distal, or intermediate phalange?
Proximal.
Good, very good. And then this one here? Okay, and how many phalanges are there on the great toe?
2,
How many phalanges on toes 2 through 5?
3.
Great. Okay, what are these here?
Metacarpals.
Carpals are in the wrist.
Oh.
Tarsals are in the hand. Tarsals, metatarsals.
Oh, okay.
Tarsals,
So,
metatarsals are in the foot.
Metatarsals.
Metatarsals, that's right. And what are these called? These bones here? See this word right there? See that word right there?
Wait.
These are the tarsals.
Oh, the tarsals. Okay.
Yeah, tarsals and then metatarsals.
Okay. Okay.
Yeah. Okay. I guess I won't take you through all these bones right now. What the heck? It's useful. All right. So let's see. If you look at the outside of your ankle, if you feel the bump that we consider to be like the ankle bone on the outside, that is the fibula, right? That's the fibula. And that's the lateral malleolus of the fibula bone. Right? And if you go down and a little bit forward from the fibula, you find one of the tarsals. Which tarsal is that? It's one of these 4. Is it A, B, C, D, or E? Which one are you feeling if you go from the fibula down and forward?
I guess it's A.
It's actually A. No, it's not A. A is on top and on the inside. A is on top. A is on top and on the inside. And the one I'm asking is here. So it's E, E. As they're labeled here, it's E, D, right? C, B, and then A. And A is like long, like that long. All right. So the one just in front and down from the lateral malleolus is the cuboid bone. It's where the deltoid ligament, I guarantee you they'll ask you this, it's where the deltoid ligament attaches. So it's here, right here, this cuboid bone. And the deltoid ligament attaches from the cuboid, like there's 3 branches, from the cuboid to the calcaneus, the cuboid to the talus, and there's one I think from the fibula to the cuboid bone. We'll take a look at the deltoid ligament. So fibula, slightly inferior, and then anterior, you run into the cuboid bone. Then there's the 3 cuneiform bones. The 3 cuneiform bones. There's the medial, the intermediate, and the lateral, right? And then on top, wrapping around the inside, is the navicular bone. It's the navicular bone's job to shift out of the way when the foot dorsiflexes. So here's the tarsals again, right? So here's the cuboid bone. Here's the lateral, intermediate, and medial cuneiform bones. And here's the navicular bone. Notice the navicular is the most on the inside and the most on the top. It's the most superior and the most medial, or it has a medial edge. Right? And it's the job of this to allow gliding of the tibia as the tibia comes forward when we like walk or when we lunge. the cuneiform bone slips backward behind the tibia, gets out of the way so that this joint space right here can close. Oops. They're just not showing. Okay, here's the navicular bone right here. The tibia is this like brighter line. It's not really shown. They've just taken the tibia off. Here's the navicular bone. No, the tibia is right here. I'm sorry. The tibia is right here. Here's the navicular bone. And this is, navicular bone is going to shift back and down out of the way as the tibia starts to glide forward a little bit as we lunge. And if we look at it from the more colorful illustration that we had earlier. Right, so here's the cuboid bone. You can tell because this is the lateral side of the ankle or the foot. This is the medial side of the ankle or foot. Right, so the lateral malleolus should be over here, which means the first tarsal that you run into is going to be the cuboid. And over the top, you have the navicular bone that goes to the inside, and then over the bottom, or over the distal aspect, you have the cuneiform bones, right? Lateral, intermediate, and medial. I didn't explain it very well. So here's the cuboid, and then over the proximal, over the top of the foot, the proximal aspect, top of the foot proximal aspect, you have the navicular bone. Top of the foot distal aspect, you have the cuneiform bones. Okay, so we are out of time. Oh, and also there's some specific movements which we'll go over next time, and we'll see those in context of the MBLEx questions. But there's some specific movements for the ankle, for inversion, eversion, dorsiflexion, plantarflexion, etc. So you can take a look at these for next time. But definitely go over these orientation terms with distal and proximal. You had a little bit of a rough time with that, Crystal, in part because I phrased them in a kind of a careless way at first. Larissa, I'm sorry, not Crystal. But definitely get to know distal and proximal. Practice all that, anterior, posterior, superior, inferior, medial, lateral. Get to know your flexion and extension, all your basic joint movements, and the idiosyncrasies of specific joint movements like dorsiflexion, plantar flexion, right, radial and ulnar deviation, etc., and circumduction. We'll be seeing those in the MBLEx questions next time. As usual, if you guys have any questions or if there's anything you want me to clarify, I'm happy to put that stuff in the notes between now and Monday, between now and our next class. And if you have any feedback on how I can make things better, other than not mixing up dorsiflexion and plantarflexion and knowing the difference between the tibial plateau and the medial malleolus, I'd be happy to receive that criticism. So have a great week, and let me know if anything comes up, okay?
Okay, and sorry about that. My phone had died, so
Oh, I'm sorry. Sorry your phone died. Well,
it's okay. It's the Apple. That's why.
I was running the recording, so you'll get to access that in just like
Okay.
half an hour, okay?
Yeah. Thank you.
You're welcome. Have a great night.
You too.
Yeah.
Bye.
All right.